I'm Sophia Aragon, a registered nurse and executive director of the Washington Center for Nursing. The Washington Center for Nursing and the Washington State Healthcare Authority are committed to engaging the powerful influence of nurses in advancing health equity in our state.
Health equity means that everyone in our state has a fair and just opportunity to be as healthy as possible. I am Dr. Quinn Huynh, a nurse practitioner and the manager for Health Equity, Social Justice, and Strategy at Washington State Healthcare Authority. Together, we are looking at ways social justice or injustice shows up in our healthcare systems and asking the question, how does it impact access to quality, affordable healthcare for Washingtonians throughout the state? To us, this means advancing social justice issues in healthcare access, cost, and delivery, supporting diversity, equity, and inclusion initiatives, and working to ensure healthcare in Washington functions with an anti-racism lens. And we know all these things are possible because we already have some incredible nurses leading the way.
Health equity is why we became nurses in the first place. And when we do not practice health equity, not only do our patients suffer, but we do too. Because we lose credibility in the communities that we serve.
Patients come with different background, different history, with different issues. If we're not engaged in the patient's health and we are biased about, their culture, their beliefs, or even just have the mentality of we know that person, if we get that bias in our head, it's hard for us to take care of the patient.
The social determinants of health that our patients are struggling with make each encounter potentially exponentially more complex. Over 80 languages are spoken by our patients. We have so many patients who are struggling with a lack of transportation or lack of healthcare insurance and inadequate access to specialists. Many of our patients are interacting with the criminal justice system and have specific needs around that. So many of our patients are immigrants and refugees and have experienced trauma and have post-traumatic stress disorder, often related to experiences that they had in other countries. So many of our patients have substance use disorders or may have an unstable housing situation. And so many of our patients are experiencing racism. These are all things that we need to address in order to be able to address their other health needs.
Healthcare is a right that people should have access to, but the problem is not that the access is not there, but people don't know how to navigate it. And I think it is crucial for us to play that role to not only give them the access or resources, but also provide them with the knowledge and understanding on how to obtain these access.
We infuse health equity issues or best of health equity practices into the education of the next generation of registered nurses and nurse practitioners. It begins with every case study. As we develop it, we think inside of that case study, what more do we need to add to this to add some complexity about caring for somebody whose life ways might be different than yours?
It is impossible to grow up in this world and not have unconscious bias. And that's something that we speak about with our residents. Without us directly having those conversations about what our standards are here and what our beliefs are and the ways that we believe that people really deserve to be treated, that we run the risk of having practitioners who go out and are actually doing harm with them and are further perpetuating that stigmatization.
Health equity requires lots of humility. It's seeing from different lenses. It's understanding with empathy what other people are experiencing so that we can develop policies and guidelines so that we can better serve these communities. So it's a journey. Health equity is something that we work on continuously.
be open, be respectful, be humble, and remember this is a time where you can connect with somebody and this is your time to make a change with them.
Everyone has a role in health equity. It's important to have someone there to advocate for you. That is what nursing should be. And that should be regardless of what you look like. You know, that's our job. You know, that's in our code of ethics.
Often nurses are the people that are spending the most time in exam rooms with patients, and we really have some of the greatest opportunity to impact patient experiences as they interact with the healthcare system.